today, new reported cases 423. Of note, yesterday, newly reported cases was at 1,295. The 7-day average of cases per day as of today is 733. Next slide. The COVID test positivity rate is currently 23.4%. That's up from 19.3% last week. The effective reproductive number has come down just a bit more to 1. Next slide. The percent of active pediatric cases among all of the cases is 38.3%. And as you can see from this slide, active cases in the 0 to 17-year-old group have continued to rise, with all other age groups continuing to fall. Next slide. This slide shows the heat map by zip code for active cases. Zip codes with darker areas represent areas with more active cases currently. And active cases are cases that have been identified in the last 14 days. Next slide. This slide shows a comparison similar to last week of the active cases on the left by zip code, and then the percent of the population vaccinated on the right. Next slide. This slide shows where we are with the population as far as vaccine uptake. Right now, we are still seeing a modest increase in folks getting vaccinated. Next slide. This is a slide that's familiar to most. It shows that of our Shelby County residents that have received at least one dose, we are at 50.3% of the population. And residents that have completed the complete series, we are at 40.7% of the population. Next slide. And this slide is different in that it shows some of the places where you can receive a monoclonal antibody treatment. So remember that in addition to vaccines, we encourage residents who are COVID-19 positive and are at high risk for severe illness from COVID-19 to seek monoclonal antibody treatments. These treatments are proven to help reduce severe illnesses for individuals considered high risk, keeping more people out of hospitals. And a few examples of high risk are older age groups, women who are pregnant, diabetics, people who have immunocompromising conditions, and folks who have cardiovascular disease. All of these things, in addition to not being fully vaccinated, put you in a higher risk category.